Hi, my name is Nicola Dunbar from the Aged Care Quality and Safety Commission, and welcome to this webinar about the role of pharmacists in residential aged care. I'd like to begin by acknowledging the traditional owners of the lands on which we're all meeting today and pay my respects to elders past, present and emerging, and also to welcome many Aboriginal people who are with us tonight. Welcome to this initiative of the Pharmaceutical Society of Australia and the Aged Care Quality and Safety Commission. We are excited about this opportunity to work so closely with the profession in this series of webinars about the roles and functions of the Commission and about the role that pharmacists can play in aged care. This first webinar is really setting the scene about what the Commission is and what it does and how that links with pharmacy, and then we'll be building on that over the coming webinars to go into more depth about specific topics and issues that are relevant, and really to explore how pharmacists can add both to better medication management for residents and assist aged care staff to improve processes, governance and knowledge. A few housekeeping things before we dive in. There is an opportunity for you to ask questions, so you would have seen in the video instructions for how to do that. We may not get to all of your questions tonight. We do have a fairly packed program, but if we don't get to them tonight, then we'll be coming back to you with information about your questions, so please feel free to put them in. The webinar is being recorded and will be available on the PSA website. And as you're probably aware, it has been accredited for CPD. So lots of reasons to watch it. So we have a number of people who are involved in the webinar this evening, and I'll introduce them as we go along. But I'm going to start by asking the Commission's Chief Clinical Advisor, Dr. Melanie Roth, about the role of the Aged Care Quality and Safety Commission. Melanie.
Thanks, Nicola. Thanks very much. Look, it's fantastic to really see over the time I've been in the Commission such a developing interest among pharmacists in aged care, rather than trying to drag people who aren't interested into the sector. So it's, the best way to add value is to have people who are experienced, interested and skilled in aged care, and it's fantastic that there's so many people interested in what we do and how you can help. The role of the Aged Care Quality and Safety Commission, overarchingly, is to protect and enhance the safety, health, well-being and quality of life of people receiving aged care. And that covers both residential aged care and home care. So we are the national end-to-end regulator of aged care services and the primary point of contact for consumers and providers in relation to quality and safety. I just want to briefly mention that word consumers, which to me, where I'm used to calling people patients or people, grates hugely. And actually, a lot of the work in the Commission, we don't refer to people as consumers, we refer to them as residents or people, but the legislation refers to them as consumers, so you will hear it. Part of our role is to promote high quality care and services to safeguard everyone who's receiving Australian government funded aged care. We also have a responsibility for approving providers and for receiving compulsory reports, including such things as the Serious Incident Reporting Scheme or SIRS and the Quality Indicator Program or QIP. So we're hoping you'll learn more about what providers are required to do and what they're striving to do in relation to the care of residents, and we will be focusing pretty much today on residential aged care, which is where we've been putting our own attention recently.
Okay, thanks, Melanie. We'll now get a bit more detail about the functions of the Commission, and to give us that, I'm going to introduce Leonie Anderson, who's one of our Assistant Directors in the Commission's Regulatory and Policy Branch. So, Leonie, if you can tell us a bit more about the functions of the Commission, that would be great.
Thanks, Nicola, and thanks, Melanie. So the Commission has three functions. The first is to independently accredit, assess and monitor aged care services, which are subsidised by the Australian Government, to conduct which includes conducting home care investigations and then determining compliance requirements, which may be against the aged care quality standards, and there might be some compliance issues regarding that, such as a sanction. The second function is to resolve complaints which we may receive about aged care services. And the third is through engagement and education to build confidence and trust in the delivery of aged care. This helps to empower consumers, but also to support providers to comply with the aged care quality standards. And we'll provide a little bit more information about the quality standards a bit later in the presentation. And all of these things together promote best practice service provision across the industry. So the Commission does this through legislation, and specifically through the Aged Care Act, which is the overarching piece of legislation. And this legislation outlines the obligations and responsibilities that aged care providers must follow in order to receive and to continue to receive subsidies from the Australian Government. The Aged Care Act has a number of what's called subordinate pieces of legislation, and these set out the rules and obligations regarding provision of care for consumers in aged care. There are a number associated with aged care, and we call these the principles. So the Act itself describes the quality of care that approved providers must provide, and these include such things as the care and services which are specified in an example of the quality of care principles, which include maintaining an adequate number of appropriately skilled staff to meet the care needs of people who receive aged care, and that the quality of that service provision is consistent with the rights and responsibilities for people who provide and then receive that care and services, and that's set out under what we call the user rights principles. And that also includes making sure that people are working within their scope of practice when providing that care. So jumping back to the first function of the Commission regarding accreditation, providers have to apply for accreditation in the first instance and then re-accreditation over time in order to receive government funding to provide services and care for consumers. And the process of accreditation assesses the quality of care and service that's delivered in accordance with the quality standards as previously mentioned. And this process enables the Commission to determine how these services are delivered, and this contributes to improved safety and continuous improvement of service delivery over time. So all residential aged care services, which is what we're focusing on in tonight's webinar, must be accredited in order to receive Australian Government subsidies. And the accreditation supports ongoing monitoring of that care and service provision, and a provider must complete that process in order to continue to receive that funding and then will continue to provide services and care. In terms of complaints, the Commission supports complainants with options on how to, first of all, raise complaints with the Commission, and then how we can assist them to resolve that complaint with the service provider. So this may include complaints about the service provider's responsibilities under the Act or under their specific funding agreement where they receive their funding for service provision. Some of the typical types of complaints that the Commission can assist with include healthcare, so wound care, medication management, assessment of care in itself, communication. This is a fairly big one that we receive a lot of about how information is shared or potentially not shared between consumers and their significant others, and how questions or complaints that are directed to the provider's staff are actually acted on or responded to. The role of staff and how they do their job. The living environment, for example, is it safe, is it secure, and is it clean? And the fees and charges that are set out in a service agreement, that's something that we respond to fairly regularly. Something that Melanie's going to touch on a little bit later is about the Serious Incident Response Scheme, and this is an initiative to help prevent and reduce incidents of abuse and neglect in residential aged care services, and this is linked with the complaints that the Commission may receive and have to act upon. The third function of the Commission is education for the sector, but also for consumers. And the Commission supports promotion of high quality care and continuous improvement among providers of aged care through information provision, education and training, such as courses and workshops which are aimed at assisting providers with assessing their performance against the quality standards, and through online education models such as the Aged Care Learning and Information Solution. In terms of consumer support, the Commission supports consumer choice in order to raise complaints, as previously mentioned, or concerns about the delivery of service, but also links consumers with advocacy services, which are offered through the Older Persons Advocacy Network, or OPAN, and they can ensure that consumers can receive the care and services in accordance with the Aged Care Charter of Rights. Thanks, Nicola.
Thank you. Thanks, Leonie. That's a really good overview. And one of the things that you mentioned there at the end was the Aged Care Charter of Rights, which is a fundamental document. Melanie, can you give us a bit more information about the Charter?
Yes, look, the Charter is a fantastic document, and Nicola used the word fundamental, which I would have to endorse. It's of fundamental importance, and a copy of this Charter of Aged Care Rights was available, I think, to you when you registered for tonight's webinar, but in case you missed it, it's also available in the resource folder and is available on the website. It's easy to search for Charter of Aged Care Rights, but I think when you read it, and it's a quick and easy read, it's a single non-dense page, you'll realise how crucially important it is in changing the things about aged care, or highlighting the things about aged care that have been the cause of a lot of the problems that we have seen. It came into effect in July 2019. It's a document that must be given to all residents, including new residents on entry, and they must be given the opportunity to sign it. It emphasises that the normal human rights that apply to all of us and to everyone in the community continue to apply. And it's really important, I think, to realise that these rights are not left behind as the door swings shut when you enter residential aged care, nor are they left behind if you have a disability or if you develop dementia or other conditions with cognitive impairment. And I think that where these rights historically have not really been afforded to elderly people in aged care, that is actually the cause of a lot of the poor conceptions of residential aged care and the fear of entering residential aged care and the fear of what they will lose if they enter residential aged care. I think it's behind a lot of those things which we're all working very hard to change, not just the perception but the reality, of course. So the Charter clarifies such issues that are relevant to aged care, or continue to be relevant when you're elderly, such as dignity, respect, cultural identity, freedom from abuse and neglect. There are several of them when you read through the list that are of particular relevance to pharmacists. The clear right to autonomy, the right to take risks, and the rights of choice and self-determination. So those are things that I think highlight that decisions can't be made about people behind their back, and that or inadvertently leaving them out of it. That process have to include them, and of course processes and information have to include information that the person wishes to know in a way that they can understand it, and obviously the rights of privacy and confidentiality and all of the professional things that pharmacists are well aware of continue to apply. There's a right to be informed about your care and your care and services in a way that they can understand, which may of course include sensory issues such as hearing, not being able to read information and language, and where people need support to explain their point of view, explain their preferences and wishes. Even if they have a degree of cognitive impairment, they still have these rights. And the relevance of this document should be clear to all of us as human beings who may one day enter residential aged care. I'd like to say, should we be so lucky, and I mean that in genuine terms, but should we be so lucky to live long enough? And many elderly people that I see will fully say their lives are still good enough to beat the alternative. Anyway, with a quick read, this will be abundantly clear when we apply it to ourselves. And of course, you can easily extrapolate to the wishes and expectations of elderly people and the community. And these rights really underpin the quality standards and our expectation in terms of the care that's delivered.
Fantastic. Thank you very much, Melanie. We seem to have a bit of an echo happening. I'm not sure. Hopefully that's okay. That sounds like it's better now. So you mentioned that the charter was in the resource folder. One of the other documents that should be in the resource folder as well is the aged care quality standards, and they're also easily, if you haven't got them, they're also easily available on the Commission's website. Leonie mentioned the standards as one of the things that's part of our core functions in terms of assessing against the standards, assessing aged care services. Leonie, can you take us back and just kind of give us a bit of a rundown of the standards as an overview, and then we'll dive into them in a bit more detail with Juanita.
Thanks, Nicola. Happy to. So the aged care quality standards are the standards that the Commission expects organisations which provide aged care services in Australia to comply with. So these are the standards that are set out for all providers of aged care services which are funded under the Commonwealth, and it's how we do our quality monitoring and assessment work. So there's 8 individual standards, and each clearly define what good aged care should look like. So I'll just read them through for you. Standard 1 is consumer dignity and choice. Standard 2 is ongoing assessment and planning with consumers. Standard 3 is personal care and clinical care, and that's often where we see medical services and pharmacists, for example, coming into play as part of Standard 3. Standard 4 are services and supports for daily living. Standard 5 is an organisation service environment, so the physical space that the service is provided. Standard 6 is management of feedback and complaints. Standard 7 is human resources, and Standard 8 is organisational governance. So each of the quality standards is expressed in 3 ways. Firstly, it's a statement of outcome for the consumer, so what a consumer or their relatives could expect in terms of service provision. The statement of expectation for the organisation, so how the organisation should be understanding and therefore applying the standards and complying with those. And thirdly, the organisational requirements in order to demonstrate that that standard has been met. And I thought I might take the opportunity to read from one of the standards. So Standard 1 is consumer dignity and choice. And the consumer outcome statement is, I am treated with dignity and respect and can maintain my identity. I can make informed choices about my care and services and live the life I choose. The organisation statement is, the organisation has a culture of inclusion and respect for consumers and supports consumers to exercise choice and independence and respects consumers' privacy. And then underneath that are a number of requirements, and that requirements is how the organisation demonstrates that they understand and apply the quality standards in practice. And I'll just read a couple of those from Standard 1. The organisation demonstrates that each consumer is treated with dignity and respect, with their identity, culture and diversity valued, that care and services are culturally safe, and that each consumer is supported to exercise choice and independence. There's more information on the quality standards on the website. There's copies available, I know, that have been provided as part of the reading pack for this presentation. And also there's more information available on an app. The Commission has created an app on the quality standards, which you can download. But there's also further information and resources available on our website for your resource and detail that you can use for further reading. Thanks, Nicola.
Fantastic. Thank you for that overview, Leonie, and I think it's really useful for people to hear about the consumer focus of the standards in terms of the overarching statement being about the what are the consumer outcomes that we're looking for here. What we're going to do now is to dive in to the standards in more detail and look at how specific standards address medication management. And most people on this webinar would either know or know of Associate Professor Juanita Breen, who has done so much work around this area and is working with the Commission at the moment. We're very lucky to have her. So Juanita, can you kind of take us through the standards and particularly around the particular things within them that are relevant for pharmacy? Just to let people know, we've had some problems with Juanita's Wi-Fi, so we don't have a visual of her. We've got a lovely photo instead, but we will be able to hear her loud and clear.
Thank you. There you go, there's my photo, and as someone pointed out, it's from a few years ago. I just wanted to say that with regards to the standards, there are three that really apply to pharmacists, and I think the first one really applies to everyone working within aged care. Standard 1, and that's about person-centred care, where consumers are very actively involved in planning decisions about the care they receive. So the way that pharmacists can really ensure that Standard 1 is met is by promoting residents to manage their own medications, to promote the choice of providers, so choice of pharmacy, and that will include who performs the medication review. Also, essential to Standard 1 is to ensure that consent is gained before medications are used. And that's really also that the consent is informed, and pharmacists have an important role to play here to provide residents with medication information. And they also, I think, really have to prove that they have the right to participate in decisions around medications, even if that decision is to not take the medication. I think one of the things that we really perhaps should work more on is to involve them more in the RMR process. For many of us, we involve the cyber, sometimes talk to the nurses, but often the resident is missed. And if they are to participate, or if they are able to be supported in that participation, relative to being involved or a carer or a PCA, it's really important to involve them in that decision making. Another standard is Standard 3, and that involves personal and clinical care. I just wanted to emphasise one particular area in antimicrobial stewardship, and that is really stressed in Standard 3. Pharmacists can promote infection control in various ways. They can support evidence-based appropriate use of antimicrobial agents. That includes antibiotics, agents, and antivirals. They can assist with developing policies for services and also protocols to promote stewardship, but also they can provide increasingly immunisations for the staff and the consumers in care. And the final standard that I think pharmacists have an important role to play is Standard 8, which is about organisational government, in that it holds governing bodies, organisations responsible for the delivery of safe and quality care and services that really helps those services to meet the aged care quality standards. And there's two areas of medication management that have been highlighted in Standard 8. And first is antimicrobial stewardship, but the second is minimising restraint, or what we're calling now restrictive practice. And the way pharmacists can really help address Standard 8 is by establishing and facilitating and leading medication advisory committees and acts to support IPC leads, or infection prevention and control leads, to really work with these people to provide systems and processes so that best practice is really embedded in the organisational clinical care, to support medication audits, and also help with benchmarking to improve quality and safety overall. So those three standards, as I said, Standard 1, 3, services to improve the quality of care they offer. Thanks, Nicola.
Thanks, Juanita. And we did have some poor sound when Juanita was speaking. I'm sorry about that. We've just got Wi-Fi issues in the kind of remote area of Tasmania that Juanita is in. I think the content that you've covered there is really important. So we'll try and make sure that we are able to provide that in a written form, because people may have missed some of that really useful useful kind of guidance that you gave throughout the standard. So we just need to deal with that tonight. We'll make sure that we do a better job with it next time in terms of making sure that connection is working better. So we just need to recognise that, but make sure you have that information as well. So I'm going to move back to Melanie now. and to talk about, we've had a question around around the new quality indicators about medication. And Melanie, can you tell us a bit about the quality indicators and the medication ones and how they relate to the standards?
Yes, and quality indicators are of particular interest to pharmacists because I think many of you will have already been asked to assist in gathering the required information. The quality indicator program was developed by the Commonwealth Department of Health after a not too lengthy but very involved process. It started off obviously with a literature review, and there's some experience in aged care with quality indicator programs overseas, and overseas they've certainly shown to make a difference in trends nationwide among such things as antipsychotic prescribing, for example. So the process also consisted of a quite extensive consultation process with many stakeholders and also a pilot. The aim, obviously, in developing the exact process was to try and balance the clinical complexities to get as meaningful information as possible relating to the subject issues of the particular indicator. But they had to balance that with the practicability, that it had to be easy to use, it had to be able to be implemented without significant burden to providers, because if all their staff are taking up all their time trying to assess and gather data, that it's obviously detracting in a significant manner from clinical care. So those are the things that were balanced. It's a mandatory program. It's legislated in Commonwealth law. It collects quality indicator data from residential aged care services, and providers are required to report this every 3 months. The stated aims are to measure important aspects of the quality of care that can affect residents' health and wellbeing. And it was developed as part of the 2019 to 20 budget measure with the cumbersome name More Choices for a Longer Life, Mandatory National Quality Indicators and Reducing the Misuse of Medicines in Residential Aged Care. I don't want to say that too often. But the program does help aged care service providers to measure, monitor their own data and to compare with similar services and to improve the quality of their services. And some of the information will be publicly available so that consumers, if they wish to, can compare things that are important to them from provider to provider. So the data will, over time, provide an evidence base that can be used to improve the quality of services provided to residents and provide information that will enable understanding trends of the sector as a whole, to identify systemic issues and to target those particular issues that are identified, and of course to enable comparisons to be made between services. And providers, crucially, will thereby be able to identify areas on which to focus and to direct their improvement activities. So currently the quality indicators are pressure injuries, physical restraint, unplanned weight loss, falls and major injury, and the fifth one is medication management, which comprises of 2 subcomponents. One is polypharmacy and one is antipsychotics. And the details of what is required, what's included, and the answer to many questions that were predicted are in the accompanying guidance material, which is on the Department of Health website, and which providers will be familiar with and may well be asking your help. So how they will be asking your help will be to interpret what things are in and out if they can't understand that themselves. And of course, many nurses who are trying to upload information may not know what is an antipsychotic and what's not, for example, and they may not be able to interpret whether individual medications according to the guidance material should be included or not included for the purposes of this data reporting. There are, the sector is very, very variable, so not all providers will have access to sophisticated software, or pharmacists on-the-ground assistance, and you may well be asked in a more ad hoc way, or see ways in which you can assist in this particular data gathering requirement. Future planned quality indicators are currently being developed, and I believe that in the future there is a plan to review the quality indicators and to fine-tune any issues that come up. But one of my most exciting quality indicators that will be coming up is requiring a measurement to be made of people's quality of life. And this is to me, a really important quality indicator, because quality of life is otherwise something that's difficult to understand except by the absence of complaints. And it's also very difficult to make a business case alone for quality of life. So having a quality indicator for this will be fantastic. It's very much of relevance, I think, in trying to interpret their own data as well, where pharmacists can have a role, particularly around standard H, which you will recall is organisational governance, and governance around medication management, and particularly as a result of the information gathered for the quality indicators, will be something that they may well need assistance with, how they can audit, how they can identify what things need to be changed or where the problem points are, and how they can address those problem points, and how you can help providers interpret their own material and look at what needs to be done in their own individual governance structure is something that really is going to need a case-by-case look by a pharmacist that's really invested in that service and the quality improvement activities of that service.
Okay. Thanks, Melanie. We've had a question actually from somebody who came in late about the difference between the Australian Commission on Safety and Quality in Healthcare and the Royal Commission into Aged Care Quality and Safety. Oh, sorry, I didn't mean Australian Commission on Safety and Aged Care Quality and Safety Commission and the Royal Commission to Aged Care Quality and Safety. So the Royal Commission was established by the government back in 2018 as distinct from the Aged Care Quality and Safety Commission, which is the regulator. So we've been talking about the work that the Commission has been doing, but actually what we're going to do now is to explore a bit some of the issues that did arise around medication use that are relevant for pharmacy in terms of the Royal Commission. So Melanie, can you give us a bit of an overview about some of the impact on the sector about the findings of the Royal Commission?
Yes, the Royal Commission is something that can't have failed to be noticed by everybody here. Certainly occupied a significant part of the media and a massive part of the Commission's time as well. But it really has resulted in a large number of submissions having been made, a large number of recommendations having been made. And there are 5 key pillars that are resulting from all of those issues that have been covered. So there's a recognition that there needs to be significant investment in reform activities around these 5 key pillars. And the key pillars were home care, residential aged care quality and safety, residential aged care services and sustainability, workforce and governance. So the Commissioners addressed many systemic issues, and I really don't have time to go into all of them, and not all of them will be relevant to you. But it's worth noting that the 2 Commissioners did have areas of divergence, and some of the recommendations they made were different from each other around certain issues. And this really just reflects the complexity of it, the diversity of the sector, and the many possible ways of looking at it. But overall, they were in agreement, and we can all have take-homes from it about the need for several areas of change or strengthening. there was highlighted that there needs to be increased oversight and introduction of serious incident response scheme, which was introduced in the 1st of April 2021. And this represents a significant step up from previous compulsory reporting arrangements, and had the aim of ensuring that providers are taking additional and necessary steps to prevent and reduce the risk of harm to aged care residents. And we'll go into that a little bit more later too. Relevant to us and to the field of chemical restraint as well for you people, is that there was a recommendation that there should be a senior practitioner for restrictive practices and strengthened regulation to assist providers to minimise the use of both physical and chemical restraint. There's a recognition that people in aged care do not consistently receive the health care that they need. There was a focus on dignity and respect, where the institutional model of care undermines some of those features, and where there were highlighted areas of self-determination, which is about autonomy and having control and choice over your own life. Involvement in decision-making, promotion of dignity, quality of life should be the constant and predominant aim of the aged care system, which if you ask any elderly person in aged care, they would absolutely agree with that statement. That caring by its very nature depends upon relationships between people. Caring relationships that leave older people feeling heard and seen and respected are essential to maintaining dignity. That any and all people receiving care are still members of our community, and that it's important that they remain engaged, valued and socially connected. And those are really important words, and it's easy for me to sort of brush over those and you to focus on the next thing, but it's worthwhile us all keeping that in mind, that any and all people receiving care are still members of our community, and it's important that they remain engaged, valued and socially connected. Thank you. The other thing to note probably is that the recommendations that were made by the commissioners were recommendations, and that the decisions about which and when to implement those are with the government, and the government response to the recommendations in the Aged Care Commission will be what we need to look to see what we can expect in the near and medium term future.
Okay, so Melanie, that's really useful to kind of make that distinction between the recommendations that were made in the final report of the Royal Commission and then what's being taken forward in the response of the government in terms of their response to the recommendations and how that's moving. What are some of the key things in terms of those kind of initiatives moving forwards, building on the recommendations that are relevant for pharmacists?
Yeah, and I would imagine that a lot of you have already seen excerpts of what are relevant to pharmacists, and you may well have had among you a number of submissions or even giving evidence before the Commission, and certainly there was much in it in relation to pharmacists, and it's really, really pleasing, I think, to see that what you have to offer can in many cases be offered by really nobody else, and that this needs to, what was previously considered a luxury, it needs to start to become normal. So pharmacists obviously have a role in the quality use of medicines throughout, and not just in relation to the quality indicators, which I've already pretty much covered off on. But there are many recommendations. Well, there's a recommendation to strengthen the roles of allied health and the pharmacists in residential aged care, and a number of highlighting of issues around residential medication management reviews, which I think you will all be well aware of and will be covering in later webinars. But many of, via their importance for residents, and how many of those, the issues that were highlighted relate to medical conditions, many of which are treated with medications, and there are many issues, as you would all be aware, with many of these medications and the oversight, governance and review of these medications.
Okay, thank you. Okay, people, we're going to live life on the edge now and see how we go, going back to Anita, who has apparently got a new phone, and hopefully we'll be able to hear her, because she's done some great work about looking at our information about complaints and issues about medication in management in our complaints that I think everybody would be really interested in hearing. So hopefully now we'll be able to hear Juanita without any problems talking about this research that she's done.
Okay, can you hear me?
Yes, that's definitely better.
Good. Okay, this is Telstra and not Optus, so not that I'm advertising for either, but anyway. Okay, now I just wanted to say that I approached the Aged Care Quality and Safety Commission at the end of last year, and I asked them could I have a look at their complaints data around medication management. And I did this because I noticed that complaints related to medication management were the top ranked complaint, that is the number one issue that people complained about for over 4 years, and that was in the annual report that the Commission releases every year about this time. And I have to say, I was really curious. I thought they'd be about medication complexity. I thought they'd be about polypharmacy. I thought they'd be mostly about restraint practice, and that's the area I've been mostly researching in. What we did find was that there were over 15,000 individual complaint issues in 2019-2020. And we filtered those down to remove those complaint issues that weren't related to clinical care. We decided that we wouldn't look at complaint issues related to wound management, oxygen management, CPAP, and just those that really specifically mentioned medication. That meant that we whittled this down to about 1,300 complaints. And we were able to have a look at what they were about, and I was quite surprised because the highest ranked complaint related to medication management was really around the timing of medication. So relatives in particular would complain about medication being missed, about medication not being started on time, or simply about some medication not being started at all, even though it was ordered, it just went missing. The next highest ranked issue, really amounting for 22% of all the complaints, was really about overall medication management as a whole. Things like not being inadequate charting, a mixture of electronic medication management systems and paper really not working and causing issues and errors. Really basic things like tablets being found on the floor, unattended medication trolleys, illegal administration, as in that carers were giving medication that really legally should have been given out by RMs or medication endorsed staff. The next highest ranked complaint issue was around sedating medication. So it was mentioned, but it accounted for 14% of complaints. The areas were also quite surprising, and the number one area by far was really around pain management and palliative care. We were hearing things like, I was reading things like about rationing of syringe drivers, that, people were being asked to pay for staff, for nursing staff to come in and administer injections, but also, more basic pain management that even, it took so much time when someone asked for a couple of paracetamol for them to actually get to the consumer or the resident. The other area that was complained about or we received feedback on was around sedating medication, but not your regular. Some of the medication was using pain management as a tool to sedate. So, there were relatives saying that, why is mum being given so much pain medication that she's not able to talk? And the final area of management was around antimicrobial use, and that was interesting as well. Whereas relatives were quite surprised that mum wasn't started on antibiotics as quickly as they would have liked, which is interesting because it sort of that really actually shows that good practice and prudent practice might be being complained about, but it really does cry out for more education for relatives. And the type of agents that we used were opioids, or mentioned were opioids, morphine, oxycodone, and risperidone was mentioned quite a lot as well. And I think the implications of this work is that, we really we need to get back to basics sometimes, instead of looking for very complex issues and side effects and those sort of things, which, yes, are important. It's really important to really help services really develop policies and procedures on basic medication management, training on pain management and palliative care, how important it is to time pain management appropriately so that, that pain doesn't build up to such a level that, relatives are complaining that their mum or their dad is in pain most of the time. So really basic sort of issues, that we can really help with, even things like making sure that the scripts get to the pharmacy on time and that there's a good process that people are medicated appropriately and adequately. Anyway, so it was quite a surprise to me and really important work, I think. Anyway, thank you, Nicola. That's what I found.
Great. Thank you very much, Juanita, and I'm really glad that we were able to listen to that without the problems that we had before, so that was really useful. We actually do have another speaker who has been waiting quietly for her chance to be in the spotlight. So I want to welcome Kerry Kensel, who is an accredited pharmacist who works with the Commission's Clinical Pharmacy Unit. And Kerry, can you tell us about that Clinical Pharmacy Unit and the work that you've been doing?
Thanks very much, Nicola. And hello everyone. I've been very fortunate to be working as an accredited pharmacist with the Commission's Clinical Pharmacy Unit to provide an outreach service to aged care in remote and very remote areas around Australia. Some of these services have been situated quite close to cities and others are hundreds of kilometres away from major centres, and they have their medications arriving on the local buses and doctors fly in. So it's been a range of services that we've been to. So far, COVID has meant that this project has not rolled out as fully in all states as we'd hoped. Coming from Queensland, my colleagues and I have been able to move about more freely. We also travel with Commission staff who are there to support us, and they've been fantastic. And one of the many benefits of this is that we've been able to share our knowledge with them and vice versa. Aged care services have always warmly welcomed our face-to-face training visits. It's always very rewarding. Our primary focus is to address the inappropriate use and management of sedative medications or sedatives in aged care, and we've been rolling out the REDUCE program, which many of you know was developed by our own Juanita Breen. So the REDUCE simply means reducing the use of sedatives and incorporates a multidisciplinary approach to care by delivering bespoke face-to-face education sessions and very practical problem-solving workshops, which are resident-focused, primarily to review the use of benzodiazepines and antipsychotics in people who are living with dementia. We aim to meet GPs associated with the aged care facilities. We meet a lot of the staff, the nurses, the carers. We try and meet with residents, and families go to resident meetings. So it's really, it really is multidisciplinary and well received, as I said. This program gives aged care staff greater understanding of sedative medications in relation to indications of use, risk benefits, and how these may impact on one's quality of life. Often I've found that aged care staff may not always link potential medication adverse effects with patient concerns, and these reduced programs have actually raised awareness for this. So, for example, staff often talk to us about residents who may be at increased risk of falls without considering that sedative medications actually may be contributing to this concern. And they're often surprised to learn through REDUCE that benzodiazepines can increase the risk of falls by 50% and increase the risk of fractures by 25%. Another example we encountered linking resident problems and medication use was at a service where care staff had concerns about a very strong male resident who had long suffered from distressing and embarrassing fecal incontinence. The staff found it difficult to assist him and he was receiving a chemical restraint. So during our sedative review workshop, we looked at this resident's medications and found a high dose of regular laxatives were charted, and it had not been considered as contributing to the concerns. Our REDUCE sessions are always really interactive, and we often learn about what staff challenges are in relation to the care of certain residents. And it's often interesting to me to have issues resolved actually in our workshops. And I think often we find that some of the staff members actually know individual residents' likes, dislikes, their triggers, current concerns, goals of care better than other staff members. And this highlights the importance of actually knowing our residents, knowing the people that live there in their homes, and the importance of communicating this information so at handovers, yes, but also the importance of documenting and updating this information as they're living there. And a lot of people we've seen have created living history documents. The lifestyle staff, some of them take great ownership with this. And this information needs to be easily accessible for all staff and other health professionals who visit, including pharmacists. So I like to give a couple of anecdotes as I go along. So I'll talk to you about this Aboriginal lady who was living with dementia and in a very remote aged care facility. And she suffered a difficult childhood and was often the target of rock throwing whilst growing up. She used to become really distressed at night, and I was told she had apparent psychotic episodes during the evening. And she was commenced on an antipsychotic after the substitute decision makers gave their informed consent. Following this, however, it was discovered that the actual room that she was living in was actually situated under this very large tree, which dropped seed pods onto the roof at night, triggering distressing memories of her childhood. This woman subsequently moved rooms and became settled. So during our sedative review session, the champion nurses worked on a sedative review plan for this lady to make recommendations for the GP to review and deprescribe that antipsychotic. As pharmacists, when conducting RMMRs, knowing as much as we can about the resident is important. And as we've said already tonight, meeting with the resident on site, talking to the substitute decision makers, hopefully they can be there as well. And, speaking with staff, reading the resident notes is so important as it enables us to form a clear picture and tailor our medication management recommendations for each individual. Our RMMRs and QUM work highlights the valuable role pharmacists play in aged care. We also have talk a lot about informed consent during our sessions, and this is a bit of a plug for the OPAN video, Medication It's Your Choice. It's been incredibly well received as it assists consumers or their substitute decision makers and the consumers with the questioning tools to be able to make informed decisions based on the information we provide, So they are able to then give their informed consent or not. The video also reminds us that the role of the substitute decision makers is that we're meant to step into their loved one's shoes and consider what their loved ones would want. We've had long discussions about residents' rights to be able to assess a risk and make dignity of risk choices. On one occasion, or during these sessions, on one occasion, one such individual was discussed, and actually we do hear this a little bit. This person had swallowing concerns. Now, again, that is actually, requiring informed consent as to what is going to happen around that. And often they have case conferencing around these swallowing concerns. So this particular resident that I remember was quite happy to have his medications crushed, but he did not want to have that one glass of beer that he has in a week thickened. So he was very happy to sign the dignity of risk form so he could have this. It was part of his quality of life decision making. So the other thing just around swallowing is, don't forget when you're doing your reviews that if someone has developed swallowing concerns, just have a quick look that a medication isn't contributing to that concern or something new that's been started. So I recommend that you check out this OPAN video, Medication It's Your Choice. You can run it during your QUM sessions, send out to residents and their families. It's really great. So prior and during our visits, the pharmacy unit identifies challenges services may face, and we love to hear their stories. I'm constantly reminded of the importance of respecting cultures and traditions. In relation to, I've visited several places in the Territory, and it's incredible to see that in some of these places how connected elders living in aged care homes are with their communities. They still contribute so much to the community and in teaching so much to the next generations. In some places, they're still passing on their secrets about bush medicine, and they often go out into country to collect leaves and bark, and then they'll bring them back to the aged care facilities and actually make bush medicine there on site. Dying on country for Aboriginal people is generally their preference. And some of our work has been to help overcome the barriers in some services so that dying on country can occur. And I know Melanie's seen this, but it's been very rewarding to hear successful outcomes when we've helped link palliative care teams overcome barriers with services and to hear their stories. Talking about quality of life, and this is probably a bit of an aside to the to medication, but in the Territory there are some services or providers have actually developed or made these huge fire pits so that the residents can actually enjoy and gather around these fire pits, because the burning timber and smoke, as well as the intense smell of ash after the fire has gone out, is also an important connection to country.
Kerry,
our
thank
pharmacy
you.
Work,
sorry.
Yep. Our pharmacy work has had many successful outcomes in areas such as end of life, supporting pharmacists with their QUM and RMMR services, helping to initiate regular MAC meetings, pain management, antimicrobial stewardship, and supporting regulatory requirements. Our on-the-ground work also further identifies what the sector may want or need, which Juanita's actually has talked a little bit about. And this enables us to develop programs. Now, at the moment, it's very exciting, but we're currently rolling out in pilot sites a UTI management program called To Dip or Not to Dip. So stay tuned for that one. So, Nicola, sorry, that was a long answer to your question. Thanks very much.
It was a really good answer, Kerry, because it's just great to hear that kind of real-life examples of what you're seeing when you're going out there. I think it's just such a fabulous, a great lesson for the services, but also what we can learn from those processes is really good. We've had a question about giving a link to the video, the OPAN video that you mentioned. If you go to opan.org.au/yourchoice, if you just Google it, I'm sure that it will come up. Okay, we're at time now. I'm just going to quickly throw to Melanie before we close, just to give us a quick overview around the topics that are going to be coming up in the next series of webinars.
Sure, we've got several topics that we're planning to discuss, but if there are any things that you would particularly like us to focus on, I'm sure we'll be able to fit it in. Just some of the questions are coming through in relation to the intricacies of some of the quality indicators, etc. Just wanted to let you know that we've got an info line at the Commission if you've got specific queries that aren't answered in the guide. Developed or can change. We're just at the moment the data recipients. So future topics, we're going to look closely at goals of care, informed consent and person-centred care planning, chemical restraint, polypharmacy and deprescribing in residential aged care, some tricky medications and you might want to contribute to that, governance and quality improvement, and various other things that you might like to influence if you let us know now. But thank you so much for participating. We really, really value how many of you appear to have a really good interest in aged care.
Thanks, Melanie. We've had quite a few questions, quite specific questions that we haven't been able to get to today, but we will be looking at those and looking at ways that we can make sure that we share the answers to these questions. And a number of the issues may well be covered in future webinars. So we're looking at having the next one in November, so stay tuned about details for that. And thanks very much for your attendance tonight and putting up with our technical difficulties. I hope it's been a useful webinar. Thanks very much.